Health to order on today, January 28th at 7:06 p.m. here in the Slade building. We are recording and will have this meeting on the cable, so just make note of that. In our agenda tonight, we've modified it a bit to, because we have a presenter, Mr. Mike Hugo from the Massachusetts Authority of Boards of Health.
Association.
And we welcome him to our meeting, and we're gonna let him present some information to us before we go through our regular agenda.
Okay, thank you very much. I do have a lot of slides, but I just want to tell you that I'm going to be supplying the slides to you, and I wanted to keep some in as a resource for you. So if you're going, how do we deal with that problem? So I'm going to skip through some of them real fast.
Okay.
So anyway, this is our standard disclaimer that I'm not here to give legal advice, I'm here to give legal education. And so what I'm going to do, just so you have an overview, is I'm going to talk about your legal authority. There's only 2 or 3 things that I'm concerned with open meeting and with public records. I'm not going to do anything on ethics. I think I have 1 slide just to show you for resource purposes. Then we're going to talk about the new legislation, because the new legislation changes everything for the way that we go. But what it doesn't change is your basic authority. And in Massachusetts, boards of health back in the 1700s, the legislature had the brains to say, we don't know about public health. We're going to let the boards of health across the state figure it out for themselves, what works for them. And so we have 351 cities and towns, and we have 351 boards of health. And there is no state legislation other than Chapter 111 that has anything to do with public health. And because of that, when you pass a health regulation at this table as the Board of Health, you are passing something that the courts look at as if it was a state statute. If it was your select board passing a bylaw, or if it was your planning board passing or making a ruling, those are reviewable in court, and the court will say they didn't get this right, they didn't think this through, they didn't listen to this argument. Courts won't do that with the Board of Health. What the courts do with the Board of Health is they say this is like a state legislature, the state legislature, an act of the state legislature, I'm sorry. And so what they're looking at is whether or not you had the right type of information when you made a decision, not whether you made the right decision or not. You can make the wrong decision, but if you based it in science, and if you heard both sides of the story, there's never been a case in Massachusetts that the SJC has not upheld the Board of Health, and we'll talk about that in a couple of seconds. So you have all of the authority of as if you were the state legislature. They're relying on you to make the right decision based on science. And in the past few years with COVID and everything, I actually had a Board of Health where I had to go and talk to them about, no, the Board of Health cannot ban COVID vaccine in your town. And there was actually a time where that was on their agenda, to ban vaccines because they hurt children. And how do you know that? Well, we read it in Epic Times, which is the QAnon newspaper. So it can, if that had passed, the state legislature would have said, did they consider science? Did they hear both sides of it? We can't touch it. It's a Board of Health regulation. I'm sorry, the courts would have said that. The Superior Court may have set it aside, but when it got to the SJC or to the appeals court, they would have turned it around the right way. So you have a history of case after case going way back, and these 2 on the bottom, recent cases. That was one of our cases, Cumberland Farms versus Braintree. The MAHB joined in. It was a flavored tobacco case, and that came from the SJC a week or 2 ago, I think. On the 15th of January. So that's how recent some of these cases are. The one before it was the Board of Health hitting a company with criminal penalties, and the company came in and said, "You're not the DA's office. you can't, and you're not the Attorney General, you can't come and hit us for criminal penalties. We have a right to go to court over that, and the appeals court said, no, you don't, and the SJC upheld that. The Board of Health has all the authority to charge you with a crime and to try you and give you a criminal penalty. That's how strong the state of the law is for boards of health in Massachusetts. So really, all the court does is they look to see, the court is not authorized to even weigh any evidence or find any facts. Court can't substitute its discretion or its judgment for that of this particular body, of the Board of Health. And the Board of Health is the only board in any city or town that has that kind of latitude to move. So it's an awesome, and I don't mean like cool, I mean like awesome. It's a lot of power that's vested in the Board of Health. So really, this is Chapter 111, Section 122 is nuisance, and this is really for us where the rubber hits the road, because when we get calls, and when Cheryl and I get calls from board members saying, what can we do about that? It doesn't quite violate the Code of Mass Regulations, it doesn't quite violate the statutes. And our next question is, but is it affecting people's rights, and does it present a possibility, a mere possibility, of spreading disease or harm to the public? And if the answer to that is yes, then the board has a hearing, and they say it is our opinion, and you write that in your order, it is our opinion that, and and the statute says that if in the opinion of the Board of Health that there's a condition that could affect the public health, the Board of Health shall take action. And so that's another area where you get incredible power. But once you've made the determination that there is a nuisance, that it could be, well, that one with the criminal penalties, which was about 6 months ago, that was an asphalt plant in a town. It was just, it smells so bad to be anywhere near it, and people lived near it. And the houses were built even after the asphalt plant was there. Houses. So they came in and said, number one, you can't charge with criminal activity here, even though the Board of Health ordered them to stop doing it. They said, no, it's our livelihood, we're not shutting down. And the court said, no, you have to close your company up because you are now affecting the public health in the opinion of the Board of Health. So it's pretty interesting, pretty cool actually in many ways. So it's really your obligation to examine, destroy, and remove and prevent any nuisance as the case may be. And you have the authority to make any regulations. For instance, if that asphalt plant said it would cost us $100,000 to put filters in, the board can say, put in the filters or go out of business. So you can make any reasonable order based on that. The only exception, and this applies, I think, right here in this town and at this table, is that if you have generally acceptable farming procedures, the Board of Health has no authority. And I learned that the hard way because when I was the chair in Framingham, some people came before us and they said, you know, the farmer down the street, he has this literally a tractor-drawn trailer and there's horse manure falling all over the street, and cow manure actually was what it was. And we're sick and tired of it, so we brought him in and reissued an order, and that was when his lawyers contacted the city attorney in Framingham, or the town council at the time in Framingham. Town council said there's an exception for farming, and that is really the only exception at all. You see exceptions with an S, and you see one exception. That's it. Farming is the only thing that's a total defense. And a farm is defined as 5 acres or more for purposes of making money from either the livestock or the agriculture on the farm. And that's something that you guys would run into. So this is one of my favorite nuisance cases that I have. That is the town of Great Barrington, and that's the Housatonic area of Great Barrington, and that's what the water looks like when it comes out. And we're involved right now in 2 cases that are at the appeals court that I think are both going to go directly to the SJC. I think the SJC will tell the appeals court, don't waste your time, send it right to us. We're going to take both of those cases because they both involve the same basic question. They're both out of, as it turns out, they're both out of Berkshire County. One is a cell tower where the people in the neighborhood said, well, we heard that it could be dangerous to put a cell tower near our houses, we don't want one. They came to the Board of Health. The Board of Health actually looked at a whole bunch of science on it and was convinced that because of prudent avoidance, they said, we don't, it's so conflicting, the science is so conflicting, but if we're wrong, people could die. And if we're right, then people won't die, and if we're wrong, we're gonna hurt Verizon. So the Board of Health said, don't put the tower there. And Verizon came in and said, we're putting it there, you can't stop us. The Telecommunications Act, which is a federal act, preempts you, and that's true. You can't tell Verizon that you can't put it there because of health reasons. Because of this 1998 Telecommunications Act. And so what happened in that case was the Board of Health was blocked from stopping it, but then it was put up, and you've seen cell towers, and they have all these antennas that's stuck all around the outside, and they're really ugly with all these little square boxes, rectangular boxes. And it was in place for 3 months, and the people in the neighborhood were saying, I don't feel anything, maybe we were wrong. And the Board of Health's going, phew. And then all of a sudden, one day, 3 kids missed school, and they were elementary school kids, all in the same school. They all lived next door to each other. And then the next day, more kids missed school, and the principal of the school called the parents and said, how come in your neighborhood you're all missing school, and called the Board of Health saying we may have a health issue. The principal called the Board of Health and said there may be a health issue attendant to the fact that we're missing all these kids from one neighborhood. And what happened was that the cell tower was put up, the antennas were put on, but the people didn't know that Verizon needed to lay wires there to get the power to it and to get their signal equipment all powered up. So it sat there for 3 months, not turned on, but looking like it was working, with all of the lights flashing at night and everything else. And the day after it got turned on, after 3 months, that's when the kids started showing up absent from school. There have been 3 cancer deaths in the neighborhood since that. The Board of Health issued an order to cease and desist as soon as they figured out that it's got to be the tower, because all of a sudden everybody's dizzy, they can't stand up. Older people are like grabbing the tabletop to stop from falling down. Kids were like headachy, crying, it was awful. And so people actually moved out of their homes that are living in this neighborhood. Board of Health ordered them to close down. They took the Board of Health to federal court and then moved it to Berkshire Superior Court. And the court ordered the Board of Health to rescind its order. But before that happened, the city council and the mayor ordered the Board of Health to rescind the order. And the Board of Health said no. And then when town council came to, or city solicitor came to the Board of Health meeting and said, the city cannot afford to defend itself against Verizon. What you're doing right now is going to cost us a ton of money. And so the city, the Board of Health said, okay, well, out of civic duty, I guess, we can't bankrupt our city here. So they rescinded the order, and at that point, the Board of Health actually sued, or they got sued by the neighborhood association because they rescinded their order. And so then the question for the court is, can a mayor or a city council or a town manager or a board of selectmen tell a Board of Health that you have to rescind an order? What they found out afterwards was that the city solicitor, also represents Verizon, and he didn't tell anybody that. So now it's really getting complicated.
Oh my God.
Right, it's really getting complicated. So that right now is the position that's in, is the judge said the Telecommunications Act says that boards of health have no authority at all because of a federal preemption issue. And that's wrong, because they're not saying you can't place the tower, they're saying shut it down because you're causing injury, and that's nuisance. And so that's before the appeals court right now. We won't lose. I guarantee we will not lose that. We have so many cases that are just like that with different facts, that we won't lose that. And then Great Barrington, the water case in Great Barrington, I helped them to draft a cease and desist order that told the water company, it's a privately owned company with a public water supply, and they told the water company, you have 7 days to supply 1.5 gallons per person per day of clean water in bottles to each of the households. There were 480 households, and so the Board of Health said, the fine will be after 7 days for non-compliance unless you come before us before that's showing that you're making progress on it, because it's a tall order for 7 days. The fine was $1,000 per household per day, $480,000 a day. And they came back to the Board of Health and said, we can't do this fine because our net revenue for last year was $630,000, and somewhere around noontime on the second day, we'll be bankrupt with this fining structure. So the Board of Health said, okay, $1,000 per day, period, fine. They took that to court. The judge said that the DEP had regulations that preempted boards of health from doing that. So that decision came down, and MHOA, the Mass Health Officers Association, had a convention in Springfield. This is all within the last 2 months. And the keynote speaker was the commissioner of the DEP. So the court decision said only DEP can do this. Board of Health has no authority. So I get up during lunch after the commissioner's speech for the Q&A, and I said, you're aware of Housatonic water? Yes. And you're aware of the fact that the court gave a decision last week? Yes. Have you read it, Madam Commissioner? And she said, I've read it. I know she's an environmental lawyer. From when I was practicing law, I had cases with her. And I said, so what's your position on the ruling of the court? She said, I can't discuss litigation that's pending. She said, but the judge got it 100% wrong. She said, the DEP has no power whatsoever. It's all the Board of Health. Once that water gets into the pipes, it's up to you from that point on. And which was what the briefing all said. So she actually has committed her lawyers to help me write the brief on behalf of the DEP and MAHB, showing that that court had it wrong. So we're gonna win that one too. Anyway, so but those are two examples of the extreme when it comes to nuisance, and I'm not gonna go through these because I sort of have already. You can read this when you get the slides. Aren't you happy, Mr. Town Manager?
Yes.
I told you I would do this. But if you do determine that a nuisance exists, and that's actually an order, a copy of the order that we wrote for Great Barrington. And by the way, Great Barrington was the town where they wanted to ban COVID vaccine. And I didn't know anything about the water until I went out for that hearing to stop the guy the chair from bringing that forward. And then I hear the people in the crowd talking about the water.
What was in the water?
What you're looking at there is mostly manganese is coloring it brown.
Yeah.
But it's also this haloacidic acid, which is a byproduct of the chlorine that they're trying to combat the manganese with. And when they get together, it's highly carcinogenic.
Oh my God.
So it's as bad as it looks. There are many times when somebody will come before you and you can do something, but it doesn't always mean that you should. So we always have the slide out, always. You'll see this anytime you see an MHB thing. Just because you can doesn't mean you should. So just use your common sense. Noisome trades. This is a concrete plant, and it's in this one here is in Taunton, and you can see the houses are very close all around it. And this plant operates, they break rocks and they grind them 24/7. And the people there are losing their minds. And there's actually a medical condition that we stumbled on it with the water, and we're using it here, which is called, it's called coping. And it's actually a medical diagnosis of people who are, actually it's called weathering, is if you look it up. And weathering is where you're just dealing with it day in and day out, and finally you can't do it anymore. And that's where the people are in the neighborhood. So that's gonna be our next thing. What happened there though was that the houses again were built after the plant was in operation. Many of the people moved in afterwards, so there's that question. The square white thing to the left around 9 o'clock on that slide is an elderly housing assisted living facility, which I think that's gonna be our fuel, is the people living in there are the ones that are being so badly affected. Right where the red line is, the red dot is, that's the main person who contacted us at MHB. We're working now with their Board of Health, but that's where the woman lives. You can see how close she is to the grinding operation. So that's gonna be next, but this is called noisome trade, and that would be something smelly, like the asphalt plant that we talked about a second ago. A piggery is the standard, the standard metaphor that goes with the noisome trade. It's interesting, and this is a good word for the town manager, is that if you have projects coming in that may have some effect on public health, the Board of Health should know when the planning board knows that it's going on. Because in Framingham, we had a completely approved, it was 72 houses that they were gonna build on a farm. That the guy was selling his farm, the planning board, ZBA, all the licenses, everything was done, and I kept going as the chair of the Board of Health to the planning board meetings and saying to the planning board, don't approve it because it hasn't come to the Board of Health yet, we're waiting for them to apply, and I'd say to the developer, I'm telling you now, don't invest more money because you have to come through us. Eventually, it got to the point where it was approved by ZBA and the planning board, and nobody came to us, so we issued an order stopping the whole thing. They took us to court, and they said that they had now invested like $600,000 or $700,000 in legal fees and in planning and all of that. And the court said, all the Board of Health wants you to do is to do a well test during the month of August. But the confounding factor was that 2.5 feet under the ground was bedrock for the entire farm. So there was nowhere to get water. There were houses that were in that same aquifer, where one house, the people leave every August for 2 weeks because they always, every August, they lose their water for 2 weeks because of this aquifer. And so we said, show us that you can draw water for 72 houses from that same aquifer, and we'll sign off on it. But until you show us, and the court said, show them, and they abandoned the project. At that point, they had spent over $1 million. And they didn't buy the property yet. It was all still in the preliminary stages. So anyway, this is basically a slide for you to look at later. Well, these two, but this one here basically is what I just said, is that you should go to the planning board and the Board of Health. And then this is an example of one. These are the areas in town that nobody else but the Board of Health has authority to regulate. So you know that there's a whole bunch of things that you regulate that other people do, but these things, there's no other board in the town of Hubbardston that is responsible for any of this. And so it's not just restaurant inspections in Title V. There's a lot that goes into being on a board. Inspections, I'm not gonna really get into this, but you get your inspection, you do the local law part, the state gives you the state sanitary codes and all of that. And you have complete, this is just the last one that's interesting. What happens when you refuse to access in a restaurant? You go to court, and the clerk magistrate will give you an administrative search warrant, and it can be one of you as on behalf of the board. You don't have to have a lawyer to do that. I won't go into this whole thing, but I will just point out that the Cumberland Farms, that's the site I left in red because it was January of 2025. It was this month, and that was a criminal complaint. But these are the various things you can enforce when you see the slides. And then we like to say that the judicial system is the most expensive machine ever invented for finding out what happened and what to do about it. So at all costs, your town manager will tell you at all costs, avoid going to court if you can, because it's expensive. All right, so now I'm gonna just hit real close, like 2 or 3 slides on open meeting and these things. These are the 4 tips that we have for staying out of trouble. And one of them is something that people do all the time. I don't know if you've ever met with your select board on something together or your planning board together on something, but in the instance that you ever do, make sure that you post your notice of your meeting, your agenda, because if you don't, it's gonna be the most awful experience in your life when you hear the select board misstate what your authority is, and you can't say that's not right because then you're deliberating, and you can't be deliberating as a quorum without violating the open meeting law. So if you just post a meeting, call yours to order, you can even whisper it when, during the meeting, like, call, and you're in order, and then you can speak up and you can talk freely in that meeting. So always do that. So post joint meetings. You can avoid email, and I'm gonna show you why to at the very end of this part of this production here. But you want to avoid emails, you want to avoid text messages. A lot of times people grab their phone and they're texting during a meeting. And if you text during a meeting, anything that you're texting is discoverable. And we have one Board of Health where we have a 23-year-old single kid who is the chair of the board. I cautioned him, and he looked like I think I ruined his day, because I don't know what is in his text messages. But I told him, if there's ever a request for your text messages, you have to turn your phone over to the town's attorney and trust them not to talk about the other stuff that they stumble over on your phone at 23 years of age. So I wrecked his day when I told him that. So avoid avoid any serial communications and emails, but you know that. Don't deliberate any emails. I think that you guys are pretty well covered in that. I know that you've had the trainings and all of that. Beware of reply all on your emails. That's the one thing that I want to stress, is as soon as you reply all and somebody says, I think, you've probably at that point violated open meeting. Social media. If you're all on the same social media page, if you're all on the town's Facebook page, and people are going at it, that damn Board of Health, how can they do blah 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 blah, and you say we did that because this, and this is our next move, you've just violated open meeting law because you're all looking at it. Public speak, and this is an important thing, and I would suggest that maybe Nate, you might want to make sure that your town council keeps you guys apprised of this, because any civility codes that we used to have up until about 2 years ago, a year and a half ago, they're now unconstitutional. This SJC has said that town meetings, any open meeting in a town where you allow public speak, you can't shut it down. You can give time. You could say everybody has 2 minutes. And if they want to get up and accuse you of things that you didn't even do, you know, I saw what you did with that gentleman that day out on the street corner. I mean, there's no shutting it down. There's no shutting it down. It could be defamatory. The SJC said until you reach a point where you are in imminent fear of bodily harm. And this woman here is the woman who put the select board in Southborough said that Louise Barron came in front of us, and if you see one of our presentations that we do for like one of our MHB programs, you'll see some of the SJC argument, and you'll see her. What she said was, she stood there with some placards. She was 30-40 feet from the table where the select board was, in the back of the room at a podium, holding up these placards showing different open meeting complaints that they had, and she said, you're a bunch of criminals, you have no right to violate open meeting the way you do, you decide things before you come into this room, we all know that standing here doesn't do us any good because you've already made up your minds illegally with open meeting violations, and you've been written up so many times. And the chair of the select board said, Mrs. Barron, could you please wrap it up and be quiet, stop, we don't need to hear this. And she said, you can't tell me to stop. He said, yes I can. She said, you're being a Hitler. And then the next thing you know, he by himself said, meeting's adjourned, no motion or anything. I mean, absolutely everything wrong. Everything was done wrong. But the SJC said that once you open the floor, if you're giving 2 minutes each, or if you're giving 5 minutes each, or 1 minute, whatever it is, you gotta let them go. You can't stop them, even if it's not on point. So make sure that gets into your trainings, because that's easy to fall into. And then, that's, okay, you can look at the slide later. This is one, I had a whole bunch on executive session, and I think I left one slide in. And the reason that I keep this in, those are the 10 exceptions on the right, who cares? There's only 4 that really apply, I think, to boards of health that you really need to worry about. And those, this numbers 1, 3, 8, and 10. But I think that number 10, like if you had, in Framingham, we had Genzyme and all of these biotech companies. So we had to have a Board of Health presence on their industrial review boards by statute. And so I couldn't say to the board member that was at the Genzyme meeting, hey, what's going on over at Genzyme? You can't do that. especially, you could do it in an executive session, but you can't do that in a public session. But the first one is something where you have to be real careful, and I bet you that you have hoarding in your town, just because of the demographics of this town. If you have hoarders, hoarding is a DSM-5 diagnosis. It's a psychiatric disorder, a mental disorder. And so you are actually dealing with somebody's mental health when you have a hoarding hearing going on here. And it was really weird how we stumbled onto this, but I was watching a Board of Health meeting because the director said, will you watch my board, I was watching a video. And one of the things I stumbled into as part of this meeting was they were doing a hoarding enforcement action. And this poor woman, I felt like crying watching her. She did not know how not to hoard. She was genuinely an ill person and didn't even understand. When they showed the pictures on the screen in the board meeting of you literally had to climb up and slide across the stuff to go down the hallway and drop down on the other side. It was blocked so badly, and she didn't understand that was bad. And so I'm saying to myself, if that was my wife or my mother, I wouldn't want that on TV. So I called the AG's office and I said, do you think that there's an exception under exception 1 for hoarding cases? And they said, no. I said, why? And they said, because that's for like if your health agent is cracking up, or if your town manager thinks that there's something wrong with one of the board members and wants to talk to the board about it. That's when you close the door. I said, but when I look at it, I see a comma after mental health rather than professional competence. There's another comma there. But then I see the words of an individual, and it doesn't say employee or board member or anything like that. And so she said, well, let me get back to you on that. And they had a meeting at the AG's office, and she wrote me an email and she said, we never thought of it that way. But you're absolutely right. So when you're doing hoarding, when you're dealing with anything like that, think about it. The other thing is recording meetings. This meeting is recorded, but sometimes people will show up in a meeting with a phone and they'll say, I'm going to record this meeting. And when they do that, you don't have a right to say no. All you can do is you could say, you can record the meeting because we can't stop you from recording the meeting. You have an absolute right to, but you cannot be disruptive. And in this particular meeting, the guy in yellow on the left-hand side, the board member, is, even though he has a beard and so you can't really tell, he's not wearing a mask. This is during COVID. This was December 20th, 2021. And that handsome guy with no hair, that's me, and the woman sitting next to me is Cheryl Sabara. And we went there to talk to them about masking and about boards of health and science and politics, where science and politics collide. And we probably saw it very heavily. I bet even here, I bet in cute little Hubbardston, I bet you had people that said, you can't tell me that I have to wear a mask. And so this, and that's Massachusetts, civil, that's how we got formed. That's why Mrs. Barron won her case. The SJC, if you read that decision, talks about our founding fathers, talks about how the two Quincy cousins fought with each other, and they called each other all sorts of things in Senate chambers and stuff, back in the day. It's a very colorful opinion. But anyway, so in this meeting, we came to talk about the collision between science and politics. And there's a guy who was walking around, and when I spoke, he came right up in front of me with his phone, and he's holding it right in my face. And so what happened was, and he's walking around the room, and the chair of the board asked him to please sit down. He said no. The chair of the board said, sit down or I'm going to have the police come and remove you. He sat down, and then it was too much for him to stay there. So this is what happened. So he walks across, and if I had sound, you'd hear it. But what's happening is that the chair is the guy pointing.
I warned about recording, and I asked you to stop recording. I need you to leave this meeting.
Okay.
I'm asking you to leave this meeting.
So he's asking to leave the room.
You need to
And then the woman to his right, very astutely,
It doesn't matter. I instructed you. Does not matter. Does not matter.
Okay, now she says, I'd like to make a motion to adjourn. And they did. They did no business that night, because they had to adjourn their meeting. Cheryl and I waited in the health officers, the health director's office, for 45 minutes because the guy in yellow told us, and no, by the way, that room is packed. There's probably 50 people in that room behind us. And the guy in yellow said to Cheryl, I'll meet you and your partner out in the parking lot. We can finish this discussion out there. So we did not go out in the parking lot till they were gone, and the police actually came and helped us leave. So scary. All right, public records. Again, anything. If somebody shows you something, you have to take a copy of it. You can't give them that document back until you have a copy of it. If it's shown in an open meeting, and these are very, very high level points that I'm making right now. But if you see something, you have to keep it as part of the record. The thing about text messages and emails, text messaging during a meeting is awful, and I'll show you in like 2 or 3 slides why. But I kept the slide in only so you could see that there's a web page that deals with boards of health and ethics, and on the Ethics Commission webpage, they actually have a page dedicated to boards of health. And then again, this is the same thing about if you've seen it. But this is a mayor. The mayor is in black on the left side, and she is writing to her chief operating officer about during a city council meeting where he had done a presentation in the city council in Framingham. Was notoriously rude to this mayor, and so I don't know if you can read it, but it says, I can't take this because they're assholes, in my opinion. This is the mayor. Some of them, I swear, they are the most disgusting human beings I've ever met. It's so painful. Good night, you did well enough of the abuse. And then the chief operating officer says, I'm eating frozen chocolate yogurt, then going to bed. I've hockey in the morning, and to sweat out all of the negative energy from the city council. If you don't think that got to Channel 5 News, it did.
That's how you get unelected.
That's right.
And Thatcher's okay.
She's not elected, as you
Yeah.
know. She did not
Yeah.
get reelected.
I know him too.
Yeah, yeah. And then the other one is his. No, the other one also is her. This is so ridiculous. They are wrapped around their own axle, and then she starts mentioning, he's an asshole. Phil Ottaviani's an asshole. That's the current chair of the council. He survived his election. She didn't. So that's how embarrassing it could be if you start texting in a meeting. So now let's get right quickly into the Public Health Excellence Grant. So the goal of the Public Excellence Grants is basically to give everybody the same advantages across the state. And we talk about health equity, and right now we're seeing something for the first time, part of the program, where it's more than just racial equity. It's, in fact, health equity can be something totally different. And the health equity piece right now that is being very heavily worked on is a uniform software and hardware package that will be rolled out. Every single Board of Health in Massachusetts will get computer equipment and will get software to go with that computer equipment, so that the state has one platform for all of the inspections and for all of the disease reporting. If people are doing Maven, I know that you do Maven, right?
Mm-hmm.
And people who are doing Maven, up to now, it's been a one-way exchange. You're sending your information in, and it's gone. You've just sent it in. The idea now is that you're going to get reports back from your Maven reports. You're going to know that one neighborhood has something. It's going to get very elaborate, and that to me is the biggest example, the best example of health equity, because every department, everything from Boston to Hubbardston, everybody's going to get the same exact computer equipment, because there shouldn't be anybody left behind because of money. And I'll show you in a second how that's getting funded. But the idea is to use cross-jurisdictional sharing, so that everybody is sharing certain things. You're not sharing your responsibility as a board. What you're sharing is and inspectors, nursing, social workers, and that really is decided by the governance board of the public health excellence group, and I'll talk about those in a couple of seconds. But back in 2016, the Special Commission on Local and Regional Public Health was convened by Governor Baker, and there were people from the insurance industry, from public health, from academia, nursing, hospitals, community health centers, insurance companies. Everybody had a voice on this, and what they came up with was the fact that public health is broken in Massachusetts. And that report there is actually 160-something pages long. And what it comes down to is that the way to fix things is to share services in regional groups, but not infringe upon the Board of Health. And so the idea is to have, for instance, an inspector for the entire collaborative group. That inspector would start out, it won't be in Hubbardston on every other Tuesday, and won't be in whatever towns you have. It's not like if it's Tuesday, it's Belgium. What'll happen is the inspector will be told, in the beginning, we're going to start you out on doing low-risk food. And so the whole collaborative area, you look at that as one town. You don't have borders. You go between the towns in this collaborative area, and you go do all the low-risk food. And then once they get up some trainings and stuff, because these are all mostly new people that are being hired, and once they get through the trainings, they'll graduate up to being, to doing the sushi restaurants and things like that, so really dangerous stuff. And the idea is to train inspectors from the ground up, and we're actually working with UMass right now on two things. We're working with UMass on nursing, to get a public health nursing program in their nursing programs across the state, across their campuses. We're working on getting a bachelor's in public health from UMass Amherst to feed into all of this, and total buy-in. They're absolutely in love with the whole idea. And two huge successes. I live in Wellesley, but I happen to be the shared services coordinator for the islands. And that happened because I'm from Raymond, Maine originally, which is, I don't know if you know Raymond, Sebago Lake. We go from 5,000 people on Memorial Day weekend to 35,000 people, and then on Labor Day we go back to 5. And so I know the dynamic of the islands. And we were told back when this program was being rolled out, at the very initial meeting, we were discussing whether it could ever work. I don't know if you remember Ron O'Connor or not. Ron was the director of the Office of Local and Regional Health. And he made the statement that it's not for everyone, it's not for Boston, not for Springfield, and not for the islands. And I said, why not? I said, let me try it, because if it's impossible, let me go do that, because then I'll learn everything about the program and I can help other groups later on. So what we've done on the islands now is we're now on our 4th inspector that we've hired. One left the island because she was engaged and she wanted to be with her husband. I guess that's okay. Second one we hired after her lasted 10 months. We hired him as he was an expediter in the kitchen, screaming at the chef, the salads are slow, speed it up. And one of the health directors in Edgartown said, I like this kid, let's hire him and make him into an inspector. We did. He's now the health director. At 28 years old, 10 months after being hired from a kitchen, he's the health director in Tisbury. And so he gave us a recommendation of a buddy of his who was an award-winning bartender in Edgartown, and we hired him next. And in 5 months, he went from being a bartender, all of the certifications you need, and now he's the health director in Edgartown. And these are, we starting these people like at $53,000 and making $100,000 now in less than a year. So it's working there, and that's the idea, is to build a workforce from within, to do it through sharing resources, to have better reporting systems, more equity. Small towns shouldn't suffer because they don't have the budget. It should be paid for by the state to a certain degree, and as long as people are part of these shared services groups, the state's footing the bill for everything. So, all right, so governance is each of the towns that belongs to one of these collaboratives has a vote. It's one town, one vote. I know that you guys, for some reason, are not showing up on these meetings, and I understand why. We had a very good conversation today as to why. And I think that I think we're gonna see I know we're gonna see some changes, because I'm gonna be talking to your group tomorrow morning. I'm gonna meet with them. And the timing couldn't have been better, coming here tonight. But what I would suggest is that if you have somebody who can attend those meetings, you should, because if you're at the table, you get a vote. And right now, they're hiring a nurse. They've hired an inspector. That inspector is fully available to you. You don't need to hire and bring on a part-time inspector. And I know that you're planning on a hire in immediate future. You don't need to do that. You don't need to sign a deal with anybody to do this, because this collaborative will take care of all of your inspections for you. The
have a
nurse,
question.
yes.
So, we went through this with a building inspector. The building inspector that we were sharing, it didn't work out.
Mm-hmm.
So what if this sharing doesn't work out? We suddenly find that there's a big delay in getting the inspections done. What do we do then?
Okay, so and we've seen that happen in a couple of places. There are a couple of overworked and understaffed groups, and this is all part of the startup process. But what's happened in reality is I get a phone call. You know, MAHB, we're kind of like the referee. You know, we're there for everybody. We just want this to work. And I will get a phone call from somebody, and they'll call their shared services coordinator and say, how come you can't get that inspector to show up in such and such in Hubbardston today? Why, you know, they're having an agriculture fair. They need help. They're gonna have food trucks. They need boots on the ground. Well, you know, they don't participate. We're not interested. Blah blah blah. And I said, they're part of your group, and you got funding from DPH to fund a group, not to fund what you want to do. They have as much of a vote and as much of a right as any other town. And I've had that conversation, not about you guys yet, although I think I see it coming in the future, but we're ready for it and happy to do it. Because people listen to us. I don't know why. My kids never listen to me. I don't know what my boards of health do, but they do. So it could be that you need more than one inspector for your group. You know, it could be that you don't. It could be you don't need nursing, but you do. But I mean, there are groups that don't, because each of the towns that's part of the collaborative already have nurses in some of the situations.
Yeah.
So they're looking more for social worker types.
What I see right now is that it's located in Fitchburg, and as we've seen, a lot of services just move out of Athol, move out of Gardner, move into Fitchburg, and then that creates a desert.
Yes, it does.
And personally, I would like to see an office in Gardner, and then that would serve all the way out to Athol.
Do you know physically where the inspector lives that they've hired?
No.
Because I think that matters with some of the groups, because the inspector really should never even be in Fitchburg other than to do inspections, any more than inspections. The inspector should be here or Athol or Gardner or wherever. This is their whole territory, and everybody works remotely these days anyway. You know, and now with the inspection software that they're going to be carrying, it all goes electronically. As soon as they hit an internet node, it gets sent instantly in. So they don't physically ever have to go to the office.
Now, how do communities that do have their own inspectional services versus communities that have volunteer inspectional services play out?
Okay,
like
it's not-
obviously a Hubbardston needs it more than a Gardner or a Fitchburg
Right.
because of staffing.
Right, and usually the way that plays out is once it becomes obvious that that's an issue, I work with, there are 3 regional coordinators for DPH, and the one that works here, Ileana is her name. She's amazing, she's wonderful, and we have a great working relationship. And I'll get a call from Ileana and she'll say to me, you know, we'll use you guys. Hubbardston's they're not getting the right services. Can you help out? So I'll call, because I can say things that DPH can't say. I don't work for the government. I work for you guys. You know, we're a membership organization. And DPH knows that we can say things that they can't say. So I can say, you know, you could lose this grant. DPH would never say that. But I could say you could lose, or you could lose a piece of this grant, or you could lose being the host community. If the other communities say, we're not getting the services here, DPH would never make that threat. I don't think twice about it. And so, as soon as we know that there's an inequity, I do that all the time, because it's happening all the time. It does happen. To pretend it doesn't happen, DPH doesn't have any idea how often it happens, because I get the calls now directly. But it happens all the time. And so the idea is that by saying you're doing all of the low-risk food, you're doing all housing and low-risk food for this group, then the professional staff in Gardner or in Fitchburg, they may have an inspector who does housing and food right now. Those two items are off that person's plate, because once the shared inspector is doing all housing across the whole thing, you may never have a housing case. I don't think that's the case, but you may never have a housing case in your town. You may never have a hoarding case. You may never have a landlord-tenant dispute. You may live in La La Land if that's the case, but it's so that function will never be used here. But you do have gas stations that sell candy. That's low risk food. You do have whatever it is, and as a member of the governance board, you have a vote. You can say, we're not getting the services here. You need somebody a little assertive, by the way. You can't just be a mamby-pamby and be on the governance board, especially if you're a small town, because they will roll over. They do. That's what happens when, you know, and Fitchburg they've got their way of doing things, and they're trained, in full gear right now, and you just gotta go, no, that's not right. That's not right. And the others will they'll discuss it. They'll take a vote democratically, and if they don't do the right thing, then I get told, then I make a nice, very politically correct, nice phone call directly to the health director or to whoever it is that's the block that's stopping it from happening, and we undo the logjam. But and that bottom line, it's a shared, not loaned or borrowed services program. The employees don't belong to Fitchburg. They're paid by Fitchburg. I think Fitchburg is they're the host, right? Yeah. They're paid by Fitchburg only because they have to be paid by somebody. So Fitchburg is actually paying them. They're on their benefits package. The OPEB is deducted from the grant, so they look like Fitchburg employees, but they're not. And where we see that real clearly is the other day I was dealing with a town manager where town hall is closed on Fridays. And so the HR department in the town said to our inspector, and when I say our, it's not my group, but to the PHE inspector, you don't have to work Fridays. Nobody in town works Fridays. And I called up the HR director, and well, that's the way, we don't work Fridays. So I called the town manager and I said, number one, you're getting 15% of the grant money as an admin fee. Number two, all you're doing is acting as a pass-through, so that we have somebody to do the benefits packages and withhold taxes and put the money in their account with a direct deposit. That's your whole responsibility. You cannot tell these people that they don't have to work on Fridays. And so we went to the town manager, who immediately said, but wait a minute, police and fire and DPW, they work on Fridays. They work Saturdays and Sundays. Why can't the health inspector that's not even our employee do that? So he saw it our way. But if it got ugly, then that's when I go to DPH and say, I need your authority to threaten them. And they'll say, go ahead, and I'll call the town manager back and say, you could lose the grant. You could lose the 15%. And that grant pays, that's around a $700,000 grant that we're talking about. So a year for 3 years. So we're talking serious, at 15%, we're talking serious money for a town. I said, don't put yourself in that position where DPH is looking, because then, you know, should you have paid for that meal on that trip? Take that out of your 15%. Should you have paid that hotel fee for that training when there was a cheaper room? You don't want to mess with DPH on
Are you
that.
looking for host communities?
Not at the moment.
Oh.
I know.
Think about us.
No, well, yours is, what did I say today? Was $540,000 or something a year
Yeah.
is what your group's getting, I think 547, if I remember the number right. So it's serious money, and when you talk to town managers and say, we don't want this to happen, but you gotta listen to every one of your towns. You have to do what the grant is intended to do. All right, so every town gets a piece of every. I don't know why I said 4 boards of health. I do know why, because I didn't change that slide. I'm sorry. I used the same set like 2 days ago with another town. But it's your grant, and you have as much of a right to it as everyone else does. This is what the map looks like. The white spots don't have the grant. If you look around in the southern part, if you look around Springfield won't, but the other towns around it right now. In fact, the slides, that slide that said 4, that was for Westfield. In a presentation I did the other day for their Board of Health. So Westfield and Agawam, and there's like 4 towns in that grouping there. I'm working, when I started doing this, there was Plymouth, Barnstable, and Bristol County were all white on the map when I started trying to combine groups. And I made mistakes. I made huge mistakes. Some of them don't like each other. They don't want to talk to each other. It's really funny, you know. Well, when I was trying to do Martha's Vineyard, I couldn't. I was told, don't try to get Chilmark to talk to Tisbury. Why not? They don't talk. The town managers are instructed by select board. They don't talk. There's no collaboration whatsoever ever. And I did some history work. It goes back to 1921. A stolen second base in a baseball game, and nobody in town knows why they don't like each other. They don't talk. It's amazing. That's what it came down to. Anyway, so the idea is to shift the costs to the state. You can take a look at these later. The DPH intends this to go to shared, not really a shared health director. It's more of a shared services coordinator now. They're not doing. There's none that. Well, there's one. There's one group. Leicester has a shared health director. But inspectors, public health nurses, epidemiologists, that's the sort of stuff that they're looking to do. The funding comes from ARPA, most of it, $200 million, and 98.8 million is going into the data system. That's why you're all gonna get computers. The workforce development, instead of having to travel to go get trainings, your trainings in this area will all be in. How far from Worcester are you?
27
Yeah, so
miles.
I think Worcester's probably your closest hub. So all of the trainings will be online, or if it has to be a classic training, it'll be in Worcester for your staff, not for you guys. You guys are our mercy. MHB does the boards, and we do it in. This year we're doing Northampton, Marlborough, and Plymouth. We usually do Taunton, but we're doing Plymouth because the Taunton Hotel is mistreating the immigrants that they are putting up. We were there last year. It was very unpleasant.
You're gonna go to Worcester, it suggests Quinsigamon College, it's a lot easier.
They've got some great facilities there.
Yeah,
They really do.
and it's a lot easier to get to than the Board of Health.
Yeah, well, we might, and it's a Saturday, it's an all-day thing on a
Yeah.
Saturday. We'll get word to you as to what it is. It'll be April and May. Anyway, so, and then the capacity building, so this is where the money is going. There's an additional 52.6 million from the CDC, and it's very restrictive. And you have, if you're dealing with combining money on different grants, you have to go with the most restrictive. So the example I gave a few minutes ago about meals and hotels, CDC grants, you have to use GSA rates in hotels, for instance. So, and many hotels don't have them, so we have to figure that's a work in progress. In addition to this, there's a $15 million a year base that the legislature gives to the Department of Public Health, which when all of this gets spent, that $15 million a year line item, which is a permanent line item, will fund the program indefinitely. And it's part of their annual budget. This year, the governor did cut from 15 to 9.1 because of all of this money. She said that and she asked DPH directly. She said, "Are you spending all of that?" And they said, "No, we probably could spare to lose 4 or 5 million." So she took 5 million basically off of that this year. But in her notes, when she did that, she said that I understand that this is just temporary, that we have a line item we have to respect in the future. In the budget she introduced last week, DPH had about $100 million in cuts, and the commissioner and the Secretary of Health and Human Services were very clear, as was the governor, that she is not cutting a cent from the Office of Local and Regional Health because of this program. She wants us to succeed. But she did say you can still go with 9.1 million another year or two. It's actually 2 more years. We'll be at that. She said, but I know that there's going to be inflators and everything else after when this comes back. But we're going to hold you at that. We were the only program in the entire Department of Public Health that was not cut. Was this Public Health Excellence Program. You can go through the allowable costs. If you really want to see this, I have a 5 or 6 page document that I can send you if you want to see what the allowable costs are. You probably will want to see that.
I do.
And then, so this is where Cheryl Sabara, she was on the special commission, and I think you know Cheryl, don't you, Walt? Do you know her at all? She's our executive director. She comes out and does a lot of tobacco stuff if you're having, all right, well, Cheryl was on the special commission, and she said, you can't do this without MAHB, and MAHB isn't signing on to anything if any of the boards of health have to give up any of their legal authority whatsoever. So what it looks like is, say you have a restaurant, say you have a pizza shop in town, and mice are running around in it, and you call the inspector, he comes out from Fitchburg, he goes into the pizza shop, and a mouse runs across his shoe. He says, I'm shutting you down, effective immediately. Take an appeal to the Board of Health. You can have a meeting in 2 days with them, but you're shut down until the Board of Health says you can be open. That inspector will show up, sit right where I'm sitting, will present you with all of the photographs and everything else, as if that inspector worked for you. And if your health regulation, restaurant regulations are uniform, but you may have different, you could have something different for like Body Works establishments, or there's all sorts of different licenses and stuff. They enforce your regulation, and your regulation might be completely different than Fitchburg's, but they know, that's part of their training, they know that as soon as I cross into Hubbardston, they have this quirk in their regulation I have to be respectful of. And they bring them before you do the enforcement. If it's a tobacco issue, do you sell tobacco in town?
Mm-hmm.
Okay, so have you had tobacco hearings?
No.
We haven't needed any
Okay, well, it's very
that we're
interesting.
aware of.
Those get interesting because the first offense is $1,000, second is 1, 3, and 5, I think it is the
I
way
think you're
that
right.
goes.
That's correct.
And then it's 3 days, 1 week, and a month suspension. And some boards of health say, I'm not fining. In fact, we have one Board of Health where they answer to the Inspectional Services Department, and the Inspectional Services Director called the health inspector the tobacco inspector in and said, bring me those files from the hearing. This is 4 o'clock in the afternoon for a 6:30 meeting. And the inspector brings the files in, and he takes the files, hands them to the ISD director, who, without opening them, rips the 3 manila files in half, throws them on the floor, and says, that's what I think of your inspection. He said, you're not fining them, they're my friends. Lost his job, ethics complaint, lots of stuff happened as a result. Newspapers, I mean, it was not a pretty picture at all. But
Wow.
if it's a tobacco infringement, they have to be fined. The question is, did the sale get made or didn't it? And if it got made, you have no latitude. You can mess around with the days of suspension. You can structure the fine so it's a $1,000 fine, pay us $100 a week for the next 10 weeks or something like that. You don't want to drive people out of business. We're not about punishment. We're about compliance. So, all right. So then, these are the special commission's workforce standards, and this is what's going to be, this is why people need to be in the program. Because, for instance, Board of Health members, which is the bottom line, must do an orientation to public health within 3 months of getting put on the board and have to take a foundations course within a year, which I bet you never knew. But it's been that way for 3 years, but now this is law. Inspectors have to have a high school diploma or equivalent. A health director has to have a master's in public health within, or a BA or a BS in public health within 5 years. Now, there's a lot of people who have been working, who graduated high school and they're health directors now and have been for 10 years. Nobody's expecting them to go back to college. There's gonna be a lot of grandfathering. But this is moving forward, and it's now law. It's Chapter 111, Section 27D, and which we're about to take a foray into. But these are the required certifications for, and this is where you're gonna get hung up on doing your own food inspections, because this is not gonna be waivable. You're gonna have to have a ServSafe certificate. You're gonna have to have a public health inspector training, a mass fit course, and you'll have to do a field component test in order to continue to do food inspections, even as a member of the Board of Health. There's Title V stuff, there's housing, mass fit, and all of that. Right now, you could kind of fudge it, you could kind of go do it because you're the Board of Health members, but that's, well, I should not say right now. Right now, you have to do this, but up until now, that's the way it's been. So then, I'm not gonna get into this, we talked about this a couple of minutes ago. Seamless intermunicipal function is really the way to do it. And this is not the way it should be. It should not be 10 hours for community A, 15 for that, and 10 for another. It should not be the host making decisions. We've had that happen, where it's been very embarrassing for the host, because I show up and tell in front of the host, tell the other board members that are part of the collaborative, you have, there's 8 of you, and you have one host calling all the shots. That's not right. Your host gets 1/8, just like everyone else does, and we've had to do that. And it's not a comfortable situation, but we do things uncomfortable all the time, I guess. And then, really, why would you be doing, staying in the grant? Because really, the money's coming from the state. It's not an unfunded mandate, and we actually ran this through Department of Public Health's legal department. It's not an unfunded mandate, and Mass Municipal Association agreed with us. They shot it down the first time it went through, because it was unfunded. So the law says now that if you belong to one of these collaboratives, the state pays the bill. If you don't belong to one of these collaboratives, you pay the bill. But you can't supplant. So if you have a budget, and here's where we'll talk for a second about your issue. If you have a budget and you have $20,000 in the budget for public health, and you're not using that budget because it's all coming out of this, and you say, well, you know what, the highway department needs $8,000 to fix a light. You can't do that. If the health department needed $8,000 because they were having a nursing clinic, because there was a disease outbreak, that's different, because you're still using health department funds. So the model you have right now is actually cleaner for you, where you don't really have a budget. The state would ever even be saying, can we look at your budget and see whether or not there's supplanting going on? You're better off having the revolving funds, because that's not exclusively within your budget voted on by your town meeting and all of that. And the fact is that some of it might never get spent. You know, you might be able to waive fees for next year or something, because you get so much money in your revolving account that doesn't make sense. But that would be a Board of Health decision, because that's really your account. Revolving accounts go with the boards. So here is the new law, and if you go online and look for Chapter 111, Section 27D, right now you'll see a paragraph that's about probably this big if you look at the page. There's that much. And that's only because they have not replaced it yet with the new 27D that got passed last month. That will go on for 5 or 6 pages. It's actually in the document that I've prepared, which I will send you all a copy of, an analysis of the new law, and I'll send you a copy also.
Thank you, sir.
I have an analysis that I'm gonna basically track through right now, but I also have the statute, the old statute, the new statute, and those workforce standards that you saw as part of the same document. So now, the first section, it's 27D, and then there's A, B, C, D, E, and all the way through, I think it goes through L after that. And A is just definitions. B basically says that the state has to be looking at efficiency and effectiveness and equity in public health, and that DPH has an obligation to promote and provide adequate resources to all boards of health. In other words, you can't have a town that doesn't have enough money and say, we just don't have the money for it. If you shrug your shoulders and say, we don't have the money for it, that's when DPH has an obligation under the law to say, yes, you do, here's the money. And the way is through cross-jurisdictional sharing, data collection, improving data collection, credentialing, training, technical assistance. I'm actually paid for, sitting here right now, MAHB is paid for by membership dues, which, by the way, you shouldn't be paying. That should be coming out of your collaborative. Your collaborative pays the dues to MAHB, so keep that in mind next time you get a bill, which will be, I think, July, I think is the next billing.
Yeah, well, we just paid for it.
Oh, did you really?
Mm-hmm.
Well, we can see about getting you a refund for that. We should definitely get you a refund for that.
Interesting.
So-
I would like to see proof that they paid for it on our behalf.
If they paid for it on your behalf, let's, yeah.
We need proof of that.
Yeah, well, I'll ask them tomorrow, I'm gonna be
Thank
there
you.
tomorrow. Yeah, so, is that where it was? Yes, okay, so, education, training, credentialing, all of that. So, also, that boards of health, you now have an obligation to file annual reports. The annual reporting is extremely burdensome to do. I've done them as a collaborative for the Islands group, and the last report I filed took me about 35 hours. Took me 35 hours to do for them, and I know what I'm doing. I helped to design the stupid thing, and it still took me 35 hours. And the new one that they rolled out today was part of the rollout. Is on Foundations of Public Health Services, which is bringing Massachusetts to a national level. So
I listened to their
were you
part
on
of
it?
it. I
Today?
couldn't get on Zoom, I just listened to the audio.
Okay, so you see how much work is involved. It's
Mhm.
insanity. We're hiring, actually, our group is gonna hire just a part-time person to do it because it's so burdensome, it's so difficult. But it's necessary because we need at some point, you gotta bite the bullet and get a baseline across the state. You know, it's like that, you do that in nursing all the time. You say, well, we're gonna do something that might not be the best thing to do, but we gotta do it, we need a baseline. So that's what they're working on right now.
So each town, each board of health.
Each and every Board of Health, if you, now, I think you had mentioned, do you share staff with building or something here?
No.
Okay, so if building does anything to do with public health at all, there's a component in that for them too.
So yes, we do, Nancy works for both the building department and the Board of Health. if
Okay,
that's
but,
what you
but,
mean
all
by
right,
that.
but she's doing
But
Board of
we-
Health
but-
stuff
And
here.
the
but
PD.
But we no longer have a shared building inspector.
Okay,
Like
okay.
that person, it was a shared position with the city of Gardner. It didn't end up working out
Oh,
long-term.
I know about that.
And he's no longer in
Right.
the field,
Right.
like,
Yes.
so.
Yes, I know that issue. All right, so, all right, so DPH will give all of the training and all of that, and then here, that last one is grant opportunities to be made available to supplement, not supplant. This is frosting on top. This is whatever you were doing before, but now DPH is gonna pour money on top to make sure that you can do it all. DPH and DEP have obligations back, that they have to measure the effectiveness of inspections and code enforcement. And they have to report the amount of funds to to the Department of whatever A&F is, Accounting and Finance.
Admin
And
and finance.
Admin and Finance, thank you. outside my little world. And they have to do an annual guesstimate as to how much funding they need, because somebody has to go to the legislature and say, yeah, we can make it on the 15, yeah, we can make it on 9.1. That's why we're at 9.1 right now. But when we come out of the 9.1 after 2 more fiscal cycles, they're probably the next number is not gonna be 15. In fact, I said this directly to Ken Driscoll when we were talking about it, that we should be anticipating something certainly that begins with a 2 and somewhere to the higher end by that point in time, because we will have established some real bad habits that need to be supported. And so they have to actually find a way to quantify the work that's being done by boards of health. Biannually, there's reporting by DPH and DEP to the legislature about this program. I can tell you now that as we sit here right now, there are 321 cities and towns that are in the program. I'm looking at forming two new groups, one in Essex County and then that other one around Springfield that I showed you. And we have around 8 other towns that are asking to get into an existing group they have groups around them, but there's no new group to be formed because it might be those little white blotches that you saw right in the middle of nowhere. Everyone's gonna wanna be coming in once they discover the fact that they have a budget and the budget's not gonna be sufficient, and the town managers are gonna be saying, why aren't we in this?
Now, what happens when everybody joins that and the governor has cut the budget for the next 3 years, and then we're in a time period that's harder than even now?
Right.
And poor little Hubbardston gets screwed out again.
Right.
Because there are more towns with more restaurants and more everything, just
Right.
across the board. So is this a
No,
short-term
No,
investment?
What we're doing is we're actually looking at different models of sustainability, and it's being done. There's a small number of us, and the director of the Office of Local and Regional Health is a guy named Sam Wall, and Sam, I've known Sam for 30 years, and he asked me actually because he was our health director in Framingham. I brought him to Framingham from Hudson, and Sam asked me if I could help him to come up with some ideas. In fact, I'm going to Washington in 2 weeks.
When were you in Hudson?
I'm sorry?
When were you in Hudson?
He was in Hudson.
Okay.
No,
I hired Tom Moses' daughter like 5 weeks ago.
Oh, really?
Yeah.
Okay. Yeah, no, Hudson's great. Hudson's a great little town. But Sam was the health director in Hudson, and I brought him to Framingham when we had a turnover. And now he's at Office of Local Regional Health. And we're working on something different. We're looking at a permanent piece of existing taxes, and as Sam calls them, the sin taxes. They're like tobacco, cannabis, gambling. All of those types of tax structures have a public health function, because gambling has obvious, tobacco, I mean, we're going for the ones that are no-brainers. And we're not looking at like, give us 2% of this or 5% of that. We're looking at like, give us 0.2% of tobacco, give us 0.6% of gambling. And when you're looking in small numbers like that, the only thing that we have to be careful of is we have to be taking them from existing lines within that affect health and human services. It can't be like public safety money. It has to be health and human services money, because we want to keep it within the same secretariat. But we're running numbers right now, and we think that we can build a permanent funding source that will always be there without any, even if it gets cut. So if it gets cut, they're not gonna cut the tax rate on tobacco. That's always gonna be there. So
Now, when does that become something more like a FERCog, a Franklin Regional
Yeah.
County of Regional Governments,
Yeah.
versus a planning commission? Like, cause the FERCog model works.
yeah, no. In fact, Phoebe is front and center with us on this, and I made sure when I talked to Sam that when we actually put together a committee meeting and a committee, Phoebe is at the table, because we love her model. It works. It works. The other regional model that works is the Neshoba Health District.
Yeah.
And Neshoba, what makes them work is that they're basically like one of these shared services groups already before they even become a shared services group. Because what it is it's, Neshoba is an association of boards of health. It's not really a health district. We're forming a health district on Martha's Vineyard right now, because it's 6 boards of health, 6 health directors, 18 board of health members. And the boards are now saying, why should we have a different regulation in West Tisbury than Tisbury has? And it's starting to make sense to them. That'll become a district, so they're all gonna have the same kinds of regulations. They'll still keep their boards. But in the Neshoba group, it's every board has its own regulations, and they just share. It's really a model of exactly what we're talking about right now. I gotta keep this moving, because you're gonna be here till tomorrow.
One thing from my experience working in the Medical Reserve Corps arena is that when you start getting like super large groups, I don't even know how many towns Fitchburg has in their group. So, but when you start getting
There's
large,
8 of them.
huh?
I think it's 8 or, if I had my computer open, I could tell you.
The last time I heard, they were trying to cover 14 towns, but.
Correct.
It could be that, it could be.
Yeah, but one of the things that, the models that they found out of Connecticut, was that when you start getting up above 10 towns then things start to fall apart. Things, then.
I think it's happening in Berkshire.
It gets, yeah, it
We're
gets
seeing
messy.
Berkshire is 24.
Yeah, so it needs to stay down small. I run a unit
Well,
for
you do
the
the
Medical
MRC.
Reserve Corps.
Yeah.
And it's 22 towns, but I have done a lot of work to make sure that everybody's unified. It's still too big, it should be broken down
Yeah.
into 2. But Worcester is trying to run 22 minus from 72, whatever that, 50, they're trying to run 50. That's ridiculous. So, they're
I
trying
think
to
Worcester's
cover.
broken in general right now. Worcester is extremely broken right
At
now.
on all levels,
Yeah.
yes. But, I just think that the experience says that if you can keep the number of towns together, I back up that, we would really, I think we should see a group come in this area where this desert is, so Petersham and Athol and Orange, and it's a desert out here.
Yeah.
So I would really, but keep it small. That's just a recommendation
No,
based
I-
on my own experience, and I've been in doing Medical Reserve Corps now for 20 years.
I can say this without any authority to say it or any reason to put my finger on, but I can tell you, looking in the crystal ball, I see a complete realignment. Once we get it up and running, and
Mhm.
we've had a year or 2 of experience, there are groups that are screaming right now for, we don't belong together. They don't really physically scream that, but I mean, when I look at them on the map, there's, this group here is too big and spread out. You
Mhm.
have too much influence of Gardner and Fitchburg type of an influence. They could be together with one other town.
Mhm.
The rest of you could be together as a rural kind of a
Yeah,
setup.
that would be
And-
perfect.
And
Yeah.
I think the other thing that's driving my dissatisfaction is, I pointed out on that map that Worcester, Plymouth, Bristol, Barnstable were all white when I started forming those.
Mhm.
I made huge mistakes because I forgot one thing. I forgot tobacco. And so I have 3 towns, out of a 6-town group. 3 of them belong to a particular tobacco collaborative. The other 3, one belongs to a different one, and the other 2 belong to
Oh,
yet a
yeah.
different one.
Yeah.
And so when it comes to the state spending money on tobacco collaboratives, which is huge money, I screwed that up. And I screwed it up because literally I was on the phone with Sam Wong, and Sam said, "What do you think?" And I might as well have just taken a dart and a dartboard and thrown it at the map and said, "Okay, I'm looking at my darts. All the red ones are in this group, so we're going to turn that into a group. All the green ones are in this group." You know, that's exactly the amount of science I put into it. That was me. I screwed that up. So I'm owning that for a big reason, because I think as the owner of the mess, once we get this thing up and running and we've got a couple of years going, as the author of the mess, I get to say very publicly, I messed up.
Yeah.
I didn't take tobacco. I didn't take municipal size. Obviously, look at your group. Although I didn't have anything to do with your group, but there are groups just like that in Plymouth and Bristol County.
Well, that's my point, is that
Yeah.
there should be one that concentrates on rural health.
Right.
And when you've got Gardner and Fitchburg and Lummis, there is no.
That's not rural health.
There's no
That's not rural
concept
health.
of
Right.
rural health that,
Right.
and.
Right, and that's why Phoebe and FERCog work so well.
Right.
You know, Phoebe is. Do you know Phoebe at all?
No.
Phoebe Walker. She's really the brains behind making that work. You know Phoebe, right?
I know that she works for Bob Dean.
Yes.
Yeah.
Okay. Okay. But that's what makes that work, is that they are jealously protective of their rural status,
Mhm.
and towns like Greenfield, you know, they're like the pink elephant. You know, what are you doing in our county? You know, it's a cultural thing, and none of that got into the ones I did in Plymouth and Bristol County especially. Barnstable County, that's the Cape. You guys can go have each other, just like the islands. You know,
Mhm.
the islands, it was a no-brainer. It was easy. It was not easy to get them to talk to each other in the beginning. They kept saying no until I said, "Don't you need a tick biologist?" They said, "The state will never buy us a tick biologist." They said, "Because they will." So, anyway, so we're almost getting through this. We were at 58 of 59, so we're almost there. All right, and then, all right, well, let me back up one thing. Yeah, this is where the boards of health have any vulnerability here, is that if a board of health is not performing up to the standards that are in the law, that DPH then can take action to cut funding, any state aid to that board of health, if they're just not doing it. And there are boards of health, I will tell you that there's one health director, not in either of those two counties, in a different county, way closer to here, who, when I called up, he was kind of waiting for my call, and he said to me, "Is this the call about that grant?" I said, "Yes." He said, "Well, I got 3 words for you in the grant. Go F yourself," and he hung up on me. That was our whole conversation. That was the whole, I told him my name first. And then he asked, "Is this about that grant?" Yes. And that was our whole conversation. By the way, he's one of the health directors that came to me and said, "Can you get us into a grant now?" 2 weeks ago. And I went, "Yes, I will." So anyways, but this is where we stood strong, and this is actually wording out of the statute. Nothing in this section shall limit the authority of the Board of Health as otherwise established pursuant to the general laws. And that is the whole presentation, basically.
Thank you very, very much.
Okay.
Thank you.
That was a lot longer, because this usually would have been 3 different sessions, but I'm not doing this drive 3 different times.
Thank you for coming out. We really appreciate it.
I'm happy to be here. I'm very happy to be here.
And I apologize, I forgot to introduce you, Nate, as being in attendance of the meeting.
Hello.
We opened the meeting. Sorry,
We're good.
but I'm glad you're here.
So, yes, and the number that's on there, as a couple of you know, that number is my number, and I answer the phone every time it rings if I can. So, and I don't care what time it is.
Can I ask what brought a lawyer into the world of public health?
Yeah, I actually had a very interesting legal career. I started out doing vaccine cases out of law school. The old DPT, remember the old DPT vaccine as nurses?
Yeah.
It was very reactive, and so I had tons of cases. And I had 550 cases of brain damaged babies from the old DPT shots. And so I started getting involved and getting interested in pharmaceuticals. I was doing pretty well with those cases, and a friend of mine was getting killed by industry because he was suing 2 chemical companies for polluting the water in what you probably would know as the Woburn case.
Yeah.
And,
Famous.
and they were trying to spend him into the ground and kill him. And I was making tons of money, and I was a friend of his, and I said, I will become your partner. I will make sure that you have the money that you need to take on the Woburn case, W.R. Grace and Beatrice Foods, and the movie, A Civil Action with John Travolta. That was our case. And so from that, I got into doing toxic environmental work. I got on the Board of Health in Framingham because one of the select board members wanted to go after a chemical transfer company. They was backing trucks into the property, and they were pushing the barrels off the truck, and some of them tipped over and spilled, some of them didn't, some of them tipped over and didn't spill, whatever, they didn't really care. And it was polluting a playground under the abutting elementary school. And so the select board said, if we put you on the Board of Health, will you shut them down? And I said, yes, and we did. And it was 11 public hearings, 3 hours was the shortest. It took 11 months. At the first one, the owner of the company wanted to know why I was doing this to him, like, why are you picking on us? And they ended up closing up. And then I stayed on the Board of Health after that because we had a bunch of environmental stuff going on in Framingham. And then I got on the board of MAHB, and then but my law practice, I did the original cases that you see the advertisements for now for Camp Lejeune. If you ever served at Camp Lejeune, you may have cancer, blah, blah, blah. Those were my cases in the beginning. And so I figured, after 35 years in law practice, I'm slowing down. And so retired, and then 6 months later we had COVID, so I didn't slow down. And now I love what I do. I can't stop. I love doing this. I love meeting people. I love coming to little towns like this, and and it's a lot of it's problem solving. A lot of what I do is problem solving, and I'm not afraid to take it on if I have to. So, and actually, our whole organization, I'm trying to think of, we have one PhD. She's the Department of Emergency Preparedness at Harvard School of Public Health. She's our president, and we have 3 other staffers that are not lawyers, and then we have a staff of lawyers. We're all everybody's lawyers because we're involved in all of these. We file briefs. If you get sued, if your town gets sued in any enforcement action, we're there with you, and we write the briefs. And your town, who's your town council?
KP Law.
Yeah. Right. I mean, both of those cases that you saw involve KP Law.
Yep.
So that's, yeah. But happy to help you in any way. What I want to do tomorrow is I'm going to attend by Zoom, because I think it's all by Zoom, if I'm right, that group. And I told them that I'm coming here tonight, and that I want a few minutes to talk to them tomorrow about the equity, really. You guys are not getting served. There's a lot of things that they can be doing to help you out. You're now at a point where today I learned that you're about to hire an inspector, bring somebody on to do some inspection work. You shouldn't be in a position where you need to do that. Not as a member of the grant. That just shouldn't be. That's not right.
Good chair shouldn't have been in a position where she had to volunteer and do inspections.
That's right.
Out the wazoo for the last 5 years.
That's absolutely correct.
Communication has been the.
We need some better communication.
It's crickets.
Yeah.
It's crickets.
Yeah, that's what you're telling me. You told me that, and you're right. It's not right. So I'm hoping somebody tomorrow will show up from here, and that you'll start attending them regularly.
Well, I'm going to be on it tomorrow.
I'm sorry?
I said I will be on the Zoom meeting tomorrow.
It may vary which
No, that's
board
fine.
member can do it.
That's fine. That's fine.
I mean, it's a horrible time.
Yeah, no, it's mostly health directors. It's not mostly board members, but you don't have a professional health director that's working with you. And in those instances, we hope to find a retired board member that has time to put into it.
Can they send a staff member?
Absolutely, positively
So
can.
in the event that you cannot, feel free with her allowing it to utilize Nancy to attend on Zoom.
Yeah, in fact, if Nancy can watch it, like tomorrow and just sort of be like,
Right, no.
many towns have a member and an alternate. And having the alternate at the meetings, when I run the meetings for the island group, we're pretty progressive, we're doing a lot of stuff down there. Our tick biologist, who is now the longest tenured employee under the public health program, because we started on February 20th, 2020. We started February 18th. We started 30 days to the day before the COVID emergency, was when I walked onto that island for the first time. And first thing we hired, because I couldn't get them to listen to me about inspectors and nursing and social work, none of that mattered to them. And they said, you wasted your time coming here. And as I'm just about to pick up my stuff and leave defeated, I said, what about a tick biologist? And they all, thank God. And our tick biologist, who we hired back then, is still there, is now on his 4th peer-reviewed scientific paper about, there's a disease called alpha-gal syndrome. I don't know if you guys have ever heard of it or not, but it's a meat allergy that can kill you. It literally can
Oh,
kill you.
yes, I have heard of it.
And it comes from a Lone Star tick. And the only place right now that's confronted with a problem, you have occasional cases on Nantucket, I think there's been one case from the Cape, and there are 30, 40, 50 active cases right now on Martha's Vineyard. And once you get bit by this tick and develop this disorder, you can never eat red meat again for the rest of your life.
I did hear about that.
Yeah, it's
Yeah,
and
a
Patrick
notice
Broden
came
Reynolds
through.
is on every one of the papers about it, and he's touring. He's if you had a big tick problem here, he'd come out and talk to your group and give you some ideas about tick remediation and all that. That's what he does during the winter months, because he can't be collecting ticks.
Well, that's what I was hearing one year, not this past year, but the year before. They actually came to my medical group, and we put together a whole display and
Yeah.
passed out
Yeah, there's a guy at
even tick
UMass who
removal
works with.
kits along with
Yeah.
a package of information.
Oh yeah, we
Passed
did.
out 1,400 packets, but that's what I heard. That's why we put it together, was what I was hearing from the different boards of health. We need tick information.
You know, in Martha's Vineyard, there is a huge homeless population. And right now, they're not homeless right now as we speak, because number one, the shelters open in the wintertime. And number two, people leave in the wintertime, and a lot of people have 2 or 3 homes because they do the Airbnbs, and they will rent those Airbnbs to people who live on the island during the time that they're not Airbnbs. So you have seasonal homelessness, and nobody can get their arms around what the real numbers are. So I came up with this stupid scheme. I said, well, we had some spend down money at the end of our grant last year. Let's buy 100 canisters of permethrin, which is a spray that kills ticks on contact. You put it on your clothes. You treat your clothes with it. You can wash your clothes 72 times before you have to do it again. And so we let it be known to the homeless community that are living in the woods during the summertime, that if you come out to X place, and we set up 4 or 5 different stations on the island, on this Saturday, we'll treat your tents and your sleeping bags. So when you slide into your sleeping bag, you won't be worried about ticks in your sleeping bag, or on your tent. And we had it all ready to go we were gonna roll it out on a Saturday, and on Wednesday, the Department of Conservation Resources, DCR, controls all of the state forests and all of that. You know DCR is the town manager. They sent a task force to Martha's Vineyard, because Martha's Vineyard has a 5,800 acre forest, state forest, which is 1/3 of the landmass of the island, by the way, and very heavily inhabited by encampments of homeless people. So, and the homeless people, by the way, most of them wake up in the morning in their tent. They go to the YMCA, which offers free scholarships to anybody who's homeless. They take showers in the morning. They go to work. Many of them have cars. If they don't have cars, they use public transportation. If you go to Martha's Vineyard and somebody hands you your plate at the lunch counter, that person may or may not be homeless. You'd never know it. because they're not homeless during this time of year, but they, in the summertime, they may be homeless, but they've showered, they're clean. And so the encampments are virtually empty during the daytime because everyone's working. And DCR sent a team in and with a bulldozer and a dumpster, bulldozed the camp, threw everything in the dumpster, and left the island with the dumpster to put it in the landfill on the mainland. In that dumpster were, one woman lost her 3 children in a, I'm gonna start crying, lost her 3 children in a fire, and all she had left was photographs of her kids. They were in the dumpster. Another woman had her Narcan that was now in the dumpster. She had her heroin in her pocketbook, but she had her Narcan in her tent. Lots of people don't have bank accounts, but they have cash, and it's an honor system, and nobody breaks the honor code when they're living in an encampment. There were thousands of dollars in the encampment that were all picked up, bulldozed, thrown into the dumpster, and taken away. And there were, as a result, there was 1 fatality, the woman with the Narcan. She overdosed that night. There's still 1 person in residential treatment. There were 3 civil commitments. There were 2 hospitalizations because one of the people had seizure medications that were taken and fell off his seizure meds, and 2 days later ended up in the hospital. And there was 1 really angry shared services coordinator who happens to know the commissioner of DCR and called him up and said, what did you do to my people? You know, and we actually got Brian Arrigo. I don't know if you know Brian or not. You probably do. We got Brian to come to the island on a listening tour, and as a result of that, if they were to come out here and do a raid on any kind of an encampment in your town, I would get the call first. I would call your town manager and say, send a cop over, or somebody over, to make sure that the area is secured and the people know DCR is coming. And DCR will give us about a month's notice before they do it now. It's worked up to a month. It wasn't a month in the beginning because they were doing it. But we now get about a month's notice. One of them, actually, that paid off real well was on Nantucket. There was a site where there were 2 guys that were living, and they were both in residential treatment on the mainland, but left all of their possessions in this tent. And the health director went out and picked up the tent and all of the possessions and stored them until they came back to the island. But that would have been, I thought that would have been a stroke of genius to get everybody to come out, because we had a nurse and we had a physician poised to be at each of these stations, and they were not going to talk to anybody. They were going to observe, and they were going to figure out, okay, as a trained medical eye, you can see that somebody's in crisis, and they make notes and they go back and visit that person later after they were able to identify them. And we get a number. We'd know, a rough number at least, because I think everybody would have come out of the woods. My feeling is that everybody who knew about it would have come out to get this stuff treated. And that's 100% on the grant funding. We had some money left over because we had a position that opened up, didn't fill it for a while, so we had some salary money left.
Well, that's very interesting. Thank you again for
Yes,
coming.
yes.
We do have a few items
I know
we
you're
have
doing
to
that. And
attend to.
I'm gonna head back. I have not had lunch yet, so.
Lunch.
Not
Not
lunch.
lunch. No lunch yet. I put a day and a half in today on 59 slides.
meet you, sir.
So, very
Wow.
nice to meet you.
I would like to.
McDonald's on the way home, huh?
Yeah,
I would like to pause our meeting
68
for
through
5
Gardner.
minutes, so we
Yes,
can
please.
stretch and do other things for 5 minutes. We'll
Bio
Are you gonna go through
we
Gardner?
start at
sorry?
8:55.
You gonna go through Gardner on Route 2 then?
I'm gonna go wherever